such short notice. Whitney, we are live streaming. Is that accurate? Okay, great. So this is a live press conference taking place here. I want to introduce our speakers, let you guys know about some protocols on how we're going to handle questions and get things started here. So I want to start by, let me thank some of our elected officials who are here. I know I saw Sherry Helt, Representative Helt. Thank you for being, oh, there you are, right in the front. Thank you for being here. Sheriff Shane Nelson. Thank you, Sheriff. And we have county, I think all of our county commissioners are here. Is that right? Yep. There you are. Oh, you guys are wingmen and women. Great. Thank you for that. All right. And also Mayor Sally Russell. There you are. Okay. If I've forgotten anyone, I apologize, but I thank you for being here. So I want to let you guys know who our speakers are. We're going to start with Dr. George Conway over here. He is the Senior Director at St. Charles. Now, tell me how you say that properly. They gave me the wrong, wait, the senior, wait. They gave me the wrong note here. George?
There you go. Oh, I'm Health Services Director for Deschutes County and serves as the County Public Health and Behavioral Health Administrator as well.
Thank you. So we're going to start with him. We're going to go to Dr. Fawcett, who's here. Thank you. And then Dr. Jeff Absalon, he's the Chief Physician Executive for St. Charles Medical Systems. And then Patty Adair is going to wrap it up. And then we're going to take questions from media. Ron Paradis will have a microphone, so we'll go ahead and get that circulated after we get going here. So, Dr. Conway.
Thanks, Julianne. So, thanks for joining us today. We're here to announce Deschutes County's first presumptive COVID-19 case. We understand that people are concerned about COVID-19, and we're committed to sharing the latest information and being transparent with our community so you know how to protect your family and the community. Public health values the rights of community members to enjoy confidentiality regarding their medical information. Therefore, we will not share and will resist any requests for any identifying, locating, or other information about people that are ill. What we know is that there is an adult who is currently ill. This may or may not be related to travel exposure. It's not clear if there could be community transmission, but we're working to clarify that. I want to assure you that our communicable disease nurses are very experienced in working to contain and control the spread of disease and are committed to keeping our community healthy. Deschutes County Public Health is working diligently to identify and notify all known contacts of presumptive cases through our case investigation process, and we can provide more information on that during the Q&A if you want. When public health receives a report of certain diseases, like COVID-19, public health nurses begin a case investigation, which includes identifying all known cases and contacts of cases in order to be able to get proper risk notification and assessment. This allows local public health, and this is all done confidentially and discreetly. This allows public health to then apply monitoring requirements set forth by CDC and the Oregon Health Authority. Over the past 6 weeks, Deschutes County Health Services Public Health has worked with our community partners to ensure robust and effective response if and when this should occur. This includes working directly with our healthcare system, which you'll hear from parts of later on, schools, cities, and numerous agencies to ensure coordination and communication well in advance of a presumptive case announcement, as we're making today. To prioritize response for contact investigation and other measures for community protection, public health and our health services department will not hold additional press conferences for future presumptive cases. Timely information about the status of cases in Deschutes County will be provided on the public health coronavirus update, which is on our county pages in the health services zone. Deschutes County Health Services has activated its incident management team to have dedicated staff and resources for this response. We continue to work with the Oregon Health Authority, our healthcare systems, and community partners. And by the way, it's timely that the World Health Organization declared a worldwide pandemic of COVID-19 this morning. I'd now like to introduce Dr. Richard Fawcett, who's our county health officer.
Hi, thanks for joining us. Appreciate that. I'm the health officer at the Deschutes County Health Department. I'm also an infectious disease consulting physician. I just wanted to speak very briefly about some of the specific clinical issues that come up when we're looking at monitoring and treating and managing patients with COVID-19. We've probably heard a lot about this, but I wanted to just echo that there's a lot of focus right now, of course, on COVID-19, but just to keep in mind that it's still flu season, and we still are seeing cases of influenza A and B, so every cough and sneeze may not necessarily be COVID-19. So just to also remind you all that, if you do have some of these respiratory tract symptoms, cough, fever, especially those two, that it's important to stay at home if you can. We really do recommend that. I think you're seeing that happen all over the world. Different places are having more difficulties with COVID-19 than we are currently here in Oregon. The other thing, too, is that, certainly it's always helpful to see your provider, your doctor, and if that's something you think you should do, that we recommend that. We think that's a good idea, but it is helpful to try to call ahead to let them know you have these symptoms, that we would recommend that. This sometimes would result in maybe you getting a mask, even a simple surgical mask or something, before you go into the clinic or to the urgent care, emergency care room. So that's something that's been discussed before. I think that's very important. And also, if you really are having difficulty breathing, it could be a lot of other different kinds of diagnoses that may be causing the shortness of breath, et cetera. And it's important to always call 911. That's always a good option, especially if you feel that you're getting worse quickly or you have shortness of breath. So I just wanted to echo quickly again, if you have any of these symptoms, it's important, in fact, even if you don't, but if you're in a crowded area where you're around people who may be ill, or if you yourself have some of these symptoms, even if they're mild, to wash your hands frequently. We recommend at least 20 seconds, to always cover every cough, with hopefully a Kleenex that you can dispose of quickly, or cough into your elbow if you can. It's important also to try to generate some space. This term called social distancing, which we talk about a lot in public health and is now coming more to the forefront too. 6 feet is optimal if you can. Disinfect surfaces if you can, certainly if you're around people that are ill or if you yourself are having these symptoms. And please try to stay at home if you're feeling ill if you can. Those are important issues now. And just to repeat what Dr. Conway said, that the Deschutes County Health Department is taking measures right now to do case investigation and try to figure out where this individual may have contracted COVID-19. We're working on that this morning and today and throughout the week. Thank you. I want to introduce Dr. Jeff Absalon, who's the Chief Physician Executive for St. Charles Health Systems. Thank you.
Thanks, Rich. I wanted to start by letting you know that St. Charles is here to take care of our community and our public. We are prepared for this. We have been preparing for quite some time. Approximately 6 weeks now, our teams have been working to look at every aspect of what to anticipate as COVID-19 comes to our community. As we speak, our caregivers are taking care of this patient, as we do for all patients that are ill in our facilities at this point in time. We've had quite a bit of focus on a number of things, including protecting our workforce, planning for potential surge, and preserving our personal protective equipment that is very necessary to keep patients and caregivers safe throughout. So most of our efforts have been focusing around each of those things. We have implemented certain restrictions in terms of visiting our hospitals. I'll reiterate what Dr. Fawcett mentioned, which is if you're ill, please do not come to our facilities. We are doing screening at the doors. With the World Health Organization's announcement of the pandemic, we will have some increased flexibility in terms of our ability to screen people as they present to our facilities, and that's a priority for us as well at this point in time. So as much as anything, I'd just like to make you aware that this is what we do. We take care of patients every day that have infectious illnesses, and we're prepared for this. And we'll continue to work with our public officials in terms of how we can embrace this and provide the best care possible. We will, of course, partner with public health in terms of the possibility of the exposure of this particular individual or anybody that's been in contact with that individual, and we're starting that process to investigate each aspect of that at this point in time. But again, I want to reassure you that we've been preparing, we are prepared, this is what we do, and happy to be here today. George?
Yes, it's my privilege to introduce our Board of County Commissioners Chair, Patty Adair.
Thank you, Dr. Conway. This is, I believe, about the fourth meeting we've had in the last 2 weeks, and unfortunately we're here today because someone has been declared having COVID. And my position here is to just thank you all for coming, for being here, and knowing that it's incredibly important to stay informed. And please be aware, not only do we have an excellent hospital, but we have an outstanding health department for Deschutes County. They just received an excellent award. And I want you to know we want to keep you as informed as possible as county commissioners. Please, please visit our website. I know that Whitney will be updating it on a minute-by-minute basis as much as possible, and it is Deschutes.org/COVID-19, as you see on the wall. So thank you for coming today, and I hope you have some questions for the experts in the room. Thank you, doctors.
Okay, so if we have media who have questions, we just want you to start with your name, your organization, and then follow that up with a question.
And because we're
Here?
because we're live, we're going to ask you to talk into the microphone.
Yep, thank you. Thanks, Brooke.
Brooke Snavely with Central Oregon Daily News. Mention of the research into the contact. You were doing background, willing to make comments about that?
Actually, I hope you don't mind my correcting that turn of phrase. It's not research. It's a contact investigation. And so I don't want people to think we're doing some biomedical research as part of our work. So the underlying principle is containment of infectious diseases. So the best way, and we have much experience doing this, we have many outbreaks that this has been very effective in, including the large outbreak of Ebola in West Africa in 2014 and 15. If you find cases, as you learn about it, people that are ill, and then you interview them for whom they've had contact with, and then we reach out to those folks. If they're ill, we try to make sure they get care and hopefully be tested for this, be followed, and self-isolate for at least the incubation period, which is 2 weeks. And by doing that, and then assuring that there's supply of food, et cetera, while people are self-quarantining, and then any other people that become ill, we repeat that same cycle, which is that we ask them to describe who they've been near or if they had travel, et cetera, other potential risk factors, and then follow up through those. And if we do that, we continuously build a circle around where the infection is and do our best to contain it.
Any other media inquiries? Any questions? Over here. Thanks, KTVZ.
Hi, Jordan Williams, News Channel 21. I know you mentioned you weren't going to share too much of the personal information. I may have missed the age. Can you share possibly what city the person lives in the county and whether or not they were living in a nursing home?
You did miss the age, and they live in Deschutes County.
So that was Deschutes County resident. Anyone else? You guys are being, okay, thanks.
Hi, Laurel Bronze, The Source Weekly. Is there enough tests? Like something that I've been hearing is that just on a national level, there's a shortage of tests.
Is that something that one of you going to want to field that?
Until very recently, there's been a very limited number of tests, and they had to be routed through the State Health Department, through the Oregon Health Authority. They had a capacity to test 40 per day, 40 persons per day in this state. Last week, the FDA provided emergency licensure for commercial test kits so that we know of at least there are 2 commercial providers that are able to do testing. And then there's also regional laboratories such as the University of Washington Hospital, which has stood up to do those. So the volume is rapidly increasing. There's still concern by healthcare providers, individuals, and even organizations that their staff be adequately protected while they're seeing patients, and especially while they take a swab of their nasal passages for the testing. So we want to be sure they wear the proper protective gear for that. I think very quickly, really in the next few days, we should have adequate access to testing. I should point out, though, that the testing is for people that are clinically ill. So they have the COVID syndrome is very similar to what we call, for many years have been calling influenza-like illness. So it has to be someone that has a respiratory infection, signs of respiratory infection, as well as a elevated temperature, a fever. And those are the people that should reach out to their providers. And then if they've been a name contact or if they're becoming more ill, they would be candidates for testing. I understand a lot of people are worried that, oh, gee, could I have been exposed to this? There's a general principle in public health that we don't want to waste tests on what we would call the worried well, people that are anxious. And the other thing is that unless somebody has an exposure or unless somebody has been in a circumstance that might have exposed them, if you take a test, it's actually less meaningful, the timing, et cetera. So people that are anxious and well are welcome to reach out to our department for information, look at the website, and call their provider. But the people that should be engaging with the system actively would be people that are ill.
Go ahead.
I'm Richard Coe with the Bulletin. How do you enforce or encourage self-quarantine?
Okay, well, by its nature, self-quarantine is voluntary, so there is no enforcement. We do our very best to explain why we're doing it. We do our best to demonstrate that we will continue to defend their confidentiality, and we do our best to make sure that their needs are met while they're doing it.
And do you follow up daily or?
Typically daily. And we have trained public health nurses that are very experienced with disease outbreaks, venereal disease investigation, et cetera. So these are people that are tough-minded, smart, but also very humane in their approach.
Jordan with News Channel 21 again. Did you mention how many tests people have requested in Deschutes County?
I did not.
Is there a number you can share?
There's not.
Okay. Question for the doctor with St. Charles. Can you kind of explain a little bit more about how that patient is quarantined and how they're treated? How many maybe doctors are kind of looking at that patient?
I can't speak specifics with regards to this patient. What I can tell you is that the patient is in one of our facilities, and we're caring for that patient in an isolation room at this point in time.
Oh, sorry, go ahead.
I'm Suzanne from the Bulletin. Can you tell us how many people you have under monitoring in Deschutes County?
That's a dynamic number. I actually don't know at this moment.
Is it possible to get that number?
Yes, it is possible to get that, and we'll see what we can do. We'll share it when there's thresholds that have to have been crossed in numbers so that you're not potentially compromising confidentiality. So there's various rules, including usually a threshold of at least 5, and I don't know that we're anywhere near that at this juncture. But as soon as we know and as soon as there's a need for the public to know, we will share that.
Brooke?
So this is the first presumptive case. How long have we known about it?
About 2 hours. I mean, we knew that there was a person ill. The providers felt that it was somebody that was ill enough to warrant testing. We agreed with that. It was sent through the system, through the Oregon Health Authority. So we knew that was happening yesterday, but we only found out that it was positive maybe 2 hours ago.
Thank you. Quickly, explain to me how the test works. Do we send tests over the hill, or do they get done here?
Well, the way it's been working, as I tried to mention before, is that the Oregon State Lab, the Oregon Health Authority and its state lab is in Hillsborough, has been receiving tests daily. They go by courier, and then doing their best to read them out, conduct the tests and read them out before the close of business the next day. They've had only really minor delays in being able to do that, but now that we have commercial testing available, we're hoping to be available on a much broader scale than that 40 persons per day. And there are health regulations that require for communicable diseases to be entered in essentially real time into a database that's shared, maintained by the state health department, health authority called Orpheus, and there should be a brief history and then the test results as they're read out. And the laboratories that are private will also presumably comply with that in a timely fashion.
Good. Any other media inquiries? Okay. Any electives? Do you have questions? Anything, Sherry? Everybody good? All right. Well, with that, I want to thank you all for being here. We will be following up with a press release with some of the details that you heard here. Representative Helt.
Representative Sherry Helt, I just want to make sure that we're meeting your needs from a statewide resource level, and if there's anything else that you need for me to advocate on the behalf of Deschutes County, because I know we've declared a state of emergency, so funds should be and resources should be able to be dispersed easier at the county level, and I just want to make sure that you're finding that and there's nothing else you need from me.
Well, the testing process still has quite a few kinks and wrinkles in it that need to be worked out, but I think we're on a trajectory for that. I should point out that nationally there's very, very little idea about the location and the frequency of these infections. It's just not, there hasn't been enough testing, it hasn't been extensive, it hasn't been a systematic sample. So we're really in the dark about the distribution of this in the country. I think the state of Oregon is doing a reasonable job. We do know that we have a shortage of N95 masks regionally, and any help that we can get in getting additional ones from, whether it's from the national stockpile or other inventory, would help us so that healthcare workers and field staff who are doing investigations could be adequately protected when they're both interviewing and taking specimens and examining patients.
I do want to let you know that I've been asking daily on my briefing calls about testing access, and it's been communicated to me that there was enough access. So if I can follow up with you afterwards so that I can call the director of Oregon Health Authority today and make sure that we address your concerns. And masks also, we are asking for those to be released further, and we're working on that from a federal level as well.
That'd be helpful. Thank you.
So I want to point out that there are numerous materials for media and also community members on the table back here that are great resources that you might want to take with you. I want to thank our county commissioners for hiring and retaining such exceptional people. You guys really, I believe, are some of the leaders in the state doing really great work. And thanks to St. Charles. You guys are terrific partners, and we appreciate that. So in closing, just want to thank you all. This will be the only announcement press conference of a case in this community in Deschutes. Anything else will be posted on their, I believe, on the website. So you can look there for daily updates. All right. Thank you all for being here.